Kia ora koutou katoa. Nau mai, hara mai ki tēnei webinar. So you're here to learn about our new model of care, Pou Ora Pillars of Health. So welcome to you all for taking time out of your busy and important days. And we hope that this is a really valuable session for you. Ko te mea tuatahi me karakia tīmatanga ahau. Me mahitahi mātou, ka kōrero, ka whakarongo, kia atawhai, kia manaki, mō ngā whānau me ngā hāpori katoa. Kei a rātou te tino rangatiratanga I o rātou hauora. Kia pai te taha tinana, te taha wairua, te taha whānau, me te taha hinengaro hoki. Haumi e, hui e, tai ki e. Beautiful. So I'm Marama Bakumia, Strategic Project and Events Manager at Collaborative Aotearoa. I'm joined here by Nee Brunenberg, who is our Strategic Project Manager and Digital Health Lead. And we also have Jess Morgan-French, who you'll know is the CEO of Collaborative Aotearoa. So we're doing this following our Pou Ora Pillars of Health media release that hopefully you will have seen, and the official launch of Pou Ora Pillars of Health to the sector on Friday. So we're really excited to be hosting this webinar opportunity with you, our live audience. If you do want to see the media release, it is available on our website under the newsletters and press release page. So today I have the privilege to share with you Pou Ora Pillars of Health, our new reviewed and reimagined model of care. It's grounded in a shared commitment to equity, innovation and sustainability. The model of care vision is really clear. Timely access to quality, culturally safe primary care that empowers our whānau to thrive. In this session, we're going to have a look at the whakapapa of the development of the model. I'll briefly talk about how it was co-created. We're going to explore each POU and talk about what it means for whānau and patients seeking care and what it means for your general practice, innovation and improvement. We'll also talk about a little bit about how the elements of Pou Ora can have a really profound impact on our primary healthcare system. So the journey from healthcare home to Pou Ora has been really significant, and we're actually really proud of its development because it was a truly collaborative co-design process. We know that primary care is facing both existing and new challenges, and there've been heaps of factors that have influenced this. So we know we have an ageing population and an ageing workforce. Health inequities are persistent and are worsening in some areas. There are really long wait times to see healthcare professionals in some areas, and the cost of primary healthcare is increasing. There have also been changes that are enabling us to actually deliver better care than ever before. So access to digital tools, which support administrative tasks such as AI scribes. We have whānau being able to book appointments and access their medical information through patient portals and digital front doors. And of course, we have telehealth and virtual consultations and alternatives to in-person care now. So the first step in the review and reimagine process was to engage with sector leaders, practice managers, clinicians, and those who deliver care, which we did through 3 full-day workshops in 2024. I can see from the list that some of you who were at those workshops are on this webinar, so I really hope that you see your voices and your contributions being shared through Pou Ora. So at those wānanga, we explored the influences on primary care delivery, and we also reviewed the ways that healthcare home really successfully improved models of care in our practices. We then got on to exploring new and innovative additions that would address the current needs of our sector and the communities we serve. The next phase included collaborating with those who use primary care, and we explored this with our lived experience rōpū, Claire. We invited them to share their whakaro about what is important when they seek care. We hosted heaps of online wānanga. We engaged with primary care experts in small groups and in one-on-one whakaro. Once we had the basis of the new model, we went through a really robust consultation phase where we invited our board of trustees, advisory group, Claire, and healthcare home leads. Some of you are here, and to dive into the details and provide us some really robust advice. I think this journey really reflects the evolution of primary care because it emphasised collaboration, it emphasised community engagement and responsiveness to our population and community health needs. Where aroha mai. So, introducing Pou Ora Pillars of Health Model of Care. Creating the new concept or framework for the model of care was actually a challenging but really fulfilling and powerful process. It was important to us to honour the history and the impact of healthcare home and those people who contributed to it. So we know that a kawa tree stands at the heart of healthcare home. So we used the whakaro of transforming the wood from this rākau and carving these into pou. So physically, pou are wooden carvings that are traditionally used to mark boundaries and tell stories and represent our whakapapa and our tupuna. Symbolically, I suppose pou can be used to describe foundations or guiding pillars that guide our kaupapa and help us remember and uphold what is important. So we created these 5 pou to represent what we have collaboratively identified as the guiding principles or concepts to delivering quality primary care. These can be used in your practice as your workflows or areas of focus. When combined, these 5 pou make up the pou matua, which you will have seen through our social media, and if you've read the model, you will have seen this image a lot. So that's the visual representation of the pou working together to make up the model of care. So this session, we're going to explore each of the pou and its elements. So I invite you to take notes digitally or record it. We are recording this, so you will be able to watch this and watch me again if you want to. If you're old school like me, you might want to grab a pen and paper and jot down some notes as we go. So Te Pou Kaimahi, which is our workforce. So this is a new part that's been added through from healthcare home. So this is about our focus on creating and maintaining a sustainable and skilled workforce, because our people are at the heart of delivering high quality care. At the base of this pou is kaimahi wellbeing. We need to look after the people who look after the people. This would look like having processes in place to know how our staff are doing. So this could include staff surveys, wellbeing check-ins, providing access to tools and resources that support a happy and thriving workforce. This not only sort of improves morale, but also supports staff retention, which of course is a benefit to your practice. So we've started from the bottom, kaimahi wellbeing. The next one is prioritising cultural safety, which ensures that the mana and the dignity of whānau is respected and improves trust in the system. So when whānau are seeking care, and everyone they interact with is both skilled and kind and culturally safe, it improves outcomes. And we know that it particularly improves outcomes for whānau Māori. Connected teams enhance communication and collaboration and efficiency. So, daily team huddles is one of the ways that we can connect within our teams and ensure that everyone is working together for maximum efficiency. These can be a really beautiful and fun way to start the day and helps us maintain a beautiful, positive workplace culture. The next element moving up is around advanced workforce pathways, which help our kaimahi to feel valued and ensures that we are continuously improving practice. And again, it supports our kaimahi retention. It shows that as a practice team, we are committed to our kaimahi professional growth and we are committed to maximising their impact within the practice through full scope adoption. The clinical consultant role is actually a new and really exciting addition to practice operations. This concept is being used in some practices across Aotearoa and has proven to have really positive impacts. So the clinical consultant is a senior clinician embedded in the practice whose primary purpose is to support and educate and supervise and enable the multidisciplinary team. This role enables our extended care team to work fully within their scope, maximising the impact they have within your practice. And having a multidisciplinary team ensures that we have a diverse range of professionals tailored specifically to the community needs. It also ensures that whānau have access to appropriate professionals to support their hauora. So effectively utilising a multidisciplinary team actually reduces the reliance on general practitioners and increases appointment availability. Which is something that is more important now, I think, than ever before. So Te Pou Kaimahi, our workforce pillar, really focuses on growing high-performing teams. It's knowing each person's strength, it's supporting their wairua and creating an environment where everyone can shine. So through this Pou, we've got an opportunity to shift from surviving the days to thriving, to moving beyond coping with the constant pressure, to building a team culture that energizes and sustains. It invests in the whole person because we know professional skills matter, and so does hauora and values and connection within teams. It also helps us focus on harnessing collective strength. So when we truly work as a team, each person's mana enhances the whole. So if you can imagine, your practice where kaimahi feel confident and they're supported and they're energized, and whānau who walk through the door feel safe and are cared for at every touch point. And that is Te Pou Kaimahi in action. Okay, our next Pou is ohotata, which is access to acute care. So this Pou is about making sure whānau get the right care at the right time from the right person. So it's about removing barriers, reducing delays, creating systems that respond quickly and effectively to urgent needs. While we make sure that the experience is calm and kind and well organised for both the whānau and staff. We want whānau to feel reassured that when something comes up, they have an injury or an infection or a sudden health worry, they can get help quickly. And this builds trust in the practice, in you delivering care, and in the whole primary care system. So from the bottom, this starts with at-home wellbeing. So this supports by giving whānau information and tools and resources they need to manage health concerns at home themselves when it is safe to do so. The aim here is to reduce unnecessary visits to your practice while also empowering whānau to feel confident managing their hauora sort of in between appointments. Moving up, triage technology is a really exciting enabler here. Digital triage tools can ask a few simple questions and provide clear next steps, including the ability for patients to book same-day triage assessments online. This creates a smoother workflow and reduces pressure on our reception. It ensures that urgent needs are picked up fast. It also means that clinical time is focused where it's needed most. So at the moment, we are exploring tools that will support digital triage. So we will let you know once this is ready to be put into practices. Clinical triage assessment really is the cornerstone of high quality acute care. This is where a prescribing clinician, a GP, a nurse practitioner assesses the urgency and directs the whānau member or the patient to the most appropriate care pathway. So it's backed by clinical governance. It has clear escalation pathways if the situation changes. And done well, clinical triage means fewer bottlenecks, faster resolutions, and better use of each team member's skills. Excuse me. Acute care clinics. So these are dedicated times in your practice that allocates resources for same-day demand. So this structure helps keep acute demand from sort of derailing the rest of the day's appointments. So it improves both patient flow and stress levels within the practice. So all of these elements of the access to acute care Pou work together to reduce stress and confusion for whānau when they're in, those urgent situations. It helps prevent burnout for kaimahi by creating predictable and manageable acute workflows. And make sure that the right care is provided at the right level, which protects GP time for more complex cases while ensuring that urgent needs are still met really promptly. So this Pou, I guess, when you boil it down, it's about manaaki under pressure. It's that feeling when a whānau member walks in distressed and they leave reassured, knowing that they were taken seriously, treated kindly, and given a clear plan. So that is the power of Te Pou o Hotata. Can I just check in to see if there are any questions coming through, team, or whether I carry on and answer those at the end? Carry on?
Carry on, yep.
Beautiful. Going to have a quick. So our next Pou is Te Pou Karohia, which is about shifting from reactive care to proactive, planned, and population-focused care. So we don't just wait for the phone to ring. We need to know our community, see the trends, and put the right supports in place before things get too serious, I suppose. Starting from the bottom, we talk about population stratification, which won't be new to you. This is a critical part of healthcare home. So it's when we use the data and local knowledge to understand the needs of our population, who's at risk, who's overdue for checks, who may need extra support. And it really just ensures that we can target resources where they're going to make the biggest difference. We know that health doesn't run on a 9-to-5 schedule. So extended hours, which is the next element, gives whānau more opportunities to access care without sacrificing time off work or school and other commitments. Digitally enabled automated and lean processes for preventative screening and pre-work, help ensure accurate and timely follow-up for screenings, which reduces disparities in access and outcomes. So patient apps and online tools empower whānau to self-monitor their screening needs and supports more equitable participation in preventative care. Planned care clinics, and we're seeing more of these popping up, which is it's really exciting to see. These are dedicated sessions for long-term condition management, immunisations and screenings. So proactive care is built in strategically into the week, not sort of squeezed in between urgent appointments. Virtual care is, this includes video calls, secure messaging, assessments, virtual monitoring, and that gives access to care for whānau who may struggle to come in. So it removes barriers like travel through rurality or even within our cities, childcare, mobility, having high needs tamariki, all of those things we can now deliver care virtually, which is a game changer for some whānau. And then finally in this Pou is care plans. So care plans work most effectively when they are co-designed with whānau. So they're living documents that set out goals and actions and supports so that everyone knows the plan for keeping well and managing ongoing conditions. So when we get this Pou proactive and preventive care right, we can catch issues early, which reduces the need for urgent interventions. It empowers whānau by giving them tools and knowledge and support to stay well, which in turn frees up access to acute care capacity because we've prevented or managed some serious cases and conditions before they happen. And it also strengthens relationships. So proactive contact with our whānau builds trust and familiarity between whānau and kaimahi. Te Pou Ora. So this is innovation and sustainability. And this is about ensuring or keeping our services future focused and resilient so that they can meet the needs of our community today, but still be here and thriving tomorrow. So we see this as creativity meets strategy, and where innovation is grounded in quality care and also sustainability. So it's keeping the doors open. The elements within this Pou include a digital front door. So it's making it easy for whānau to connect with us in our practice, wherever they are. So a fully enabled digital health door, a digital front door, means people can book appointments, they can check their results, read open notes, and access self-service options online. And it removes unnecessary barriers. It gives, I guess, whānau more control over their own healthcare journey, which is their tino rangatiratanga. So AI, this is obviously new, a new reimagined addition from Healthcare Home. So when used well, this absolutely can be a game changer. Whether it's supporting clinical decision-making, automating admin tasks, or helping identify care gaps, AI can free up precious kaimahi time so that they can focus on people, not just paperwork. So the emphasis here is on appropriate and safe. So tools that are going to enhance, not replace, the human relationships that are the heart of care. So this can be utilising platforms such as Heidi to scribe consultations, so that a care provider can, sit kanohi ki te kanohi with the patient while they interact instead of looking at their screen and typing. So yeah, lots of opportunities to explore how AI can support your practice and its operational functions. So succession planning, we can't be sustainable if we're not thinking ahead. So succession planning is about making sure the services keep running smoothly, even when people move on. It's about knowledge transfer, leadership development, and building depth in our teams. So we're not left sort of scrambling when someone moves on or moves out. Healthcare has a big footprint, and so we all have a responsibility as kaitiaki to shrink our environmental impact. So environmental sustainability means measuring what our environmental impact is, setting achievable goals, and contributing to climate resilience, because a healthy whānau needs a healthy planet. Finally, innovation isn't about one-off ideas. It's about building a culture of continuous quality improvement. Using proven improvement methodologies means that we can make small, smart changes that compound over time. This boosts efficiency, reduces waste, and improves care outcomes. So when we embed te Pou Ora, we future-proof our practice. We make it easier for whānau to get care, we protect kaimahi from burnout, and we stay ahead of change. And we show how sustainability, both environmental and organisationally, we show that it's possible in primary care. So this Pou, I guess, is about hope. It's about adapting and adaptability, and it's about courage to be really innovative. As the quote goes, if we keep doing what we've always done, we always get what we've always got. Ka rawe. Our final Pou within Pou Ora Pillars of Health Model of Care is te Pou Hono, which is collaboration. This is about connections and partnerships. And I suppose it's the Pou that really binds all others together, because even the best systems and processes only work when we are collaborative, when we collaborate effectively within our teams and across the health sector and with the whānau we serve. So at the heart of this Pou is whānau engagement. So practices can actively partner with whānau, community members, experienced advisors to design and evaluate and improve services. So this ensures that whānau-centred, culturally safe and responsive to local needs care is provided. So when whānau are genuinely involved, they feel heard and valued and empowered, which improves outcomes and strengthens trust in our system. So it's about asking those questions. How do we know if we are providing beautiful quality care to our Māori population? What are the experiences of our queer and takatapui and rainbow communities? How do we know? Are we inviting them to share with us their experiences in our practice? So collaboration also extends beyond our practice walls. Practices should be working really closely with their primary health organisations and really closely with kaupapa Māori services, social and community services, allied health providers, and sector support organisations. These connections are really essential for creating coordinated and seamless care. So by aligning regional strategies and sharing insights, building relationships with Māori providers, and streamlining referral pathways, practices ensure that whānau access the right care at the right time. And these relationships actually strengthen our whole system. So when a patient moves between services, nothing falls through the cracks. When kaimahi are interacting with a whānau or a patient, they know who to contact within their rohe or their community for support or guidance or specialist advice. So workflow smoother, stress is reduced, and the morale sort of improves in your practice. So I guess describing Pou Ora is more than sort of a framework. I really see this, and we do at Collaborative Aotearoa, see this as a movement that's about transforming primary care so that whānau aren't just surviving, they are really thriving. It's about creating practices where kaimahi are energised and supported and empowered to deliver the very best of themselves every day. So when these five pou are working together, whānau will experience care that is seamless, timely, and culturally safe, where every touch point reinforces trust and dignity and hauora. Kaimahi work in a system that values their well-being. It nurtures their growth and celebrates their contribution. So it turns daily challenges into opportunities to shine. Practices become more resilient, more innovative, and future ready. They're able to adapt and improve and sustain excellence, even as demand grows and needs change. So we invite you to join us in reimagining primary care and to build a system that really is connected and compassionate and courageous. And we believe that Pou Ora gives the tools and the structure and the philosophy, I suppose, to do exactly that. Okay, so we at Collaborative Aotearoa have been developing a range of toolkits that will support you in embedding each of these elements of Pou Ora into your practice. So here are a couple of examples. The AI Enabler Toolkit. So this contains videos and policy templates and PIAs, and other helpful information to help you really safely and effectively embed AI. The other example we have here is a guide for practices employing a physician associate. So this is an example of a toolkit that helps support a multidisciplinary team under the Pou Kaimahi Pou. So this includes case studies from real practices. It discusses regulations and scopes of practice and helps you know how to settle in a new PA into your practice. So all practices whose PHO is a member of Collaborative Aotearoa, or those who have our new level of membership, which is a practice level. So if your practice isn't part of a PHO, you can still become a member of Collaborative Aotearoa. You have access to all of these toolkits, and they will continue to be developed over the next 6 months to the year. The last thing I just want to show you before I hand over to Jess, our CEO, is just to show you a bit of our journey, or what we are going to be working on as a team over the next 3 years. So this is a long-term project. So you'll see here each of our pou and then each of the years that the different tools or things that we're going to explore will be explored. So some of the things are still, a wee while away while we work with our partners to create the platforms or to create the digital tools. But we wanted to show you this just to show that we are on, it's a long game here, and we're constantly keeping up with new technology and developing new technology to support you to deliver really effective primary care. Kia ora. So, Jess, I will pass to you now.
Kia ora, marama, and what a brilliant presentation and reflection of the 5 Pou and all of the gorgeousness that sits within them. So ngā mihi nui for sharing the whakaaro, not only from the journey of developing the Pou, but also the richness from within that Pou. It's an incredible journey that we've been on with our members, with our sector, with people working in general practice to ensure that we get it to this point. And I think at this point, not got it 100% right, and I don't think we ever will. It's a time for us to look at what we can do and what we do have, and we'll continue to build on that as models of care continue to evolve and continue to I guess be reimagined and reviewed throughout our time within the health sector. So although Pou Ora provides us with an excellent framework to be able to structure our general practice operations, and I always talk about that as being the what do we do within our 4 walls, how do we organise ourselves to ensure that we can deliver the best possible care, but I think, you know, we will also evolve as we go through, just like we did with healthcare home. This will be no different. It's a journey of evolution, it's a journey of change, it's a journey of digital adoption, and looking at how we can continue to grow and extend ourselves within the system that we are given. I've written a little poem to wrap up our webinar today, but I do note we've got a little bit of time left. So while I'm reading the poem, feel free to drop in lots of questions into the Q&A. There was one earlier around other AI tools opposed to kind of AI scribes, and that's something the collaborative's been looking into for kind of the last 6 months and being quite interested in. We are working with Elsevier on the clinical key tool and have been really interested in that adoption into New Zealand. It's a great tool for kind of medical research and looking at evidence-based plans and approaches to supporting patients and their management and medicine plans. We're also having a look at a few other really exciting tools, especially around ear health, looking at children's eardrums. We're looking at other clinical kind of diagnostic tools in terms of how it may support kind of other pathways and routines within the system. So we are hot on all things AI. It can support with administrative burden and kind of the support system in there, but it can also really support with access to diagnostics where we may not otherwise have that support. So really excited about the future for AI, but what we do bring at Collaborative Aotearoa is kind of 2 things. The first thing is we need to use AI with education. If we're not educating our kaimahi to use these tools extremely well, then there's going to be room for the tool to be used inappropriately or to be used in an unsafe way. And then we need to ensure that we apply clinical and cultural safety to all AI tool adoption into general practice. So thinking about how you do that along the way and what that looks like, and ensuring that you're also doing it in a way that meets our privacy standards in New Zealand. So on that note, I'm going to read you a little poem. I hope it lightens up your day, but feel free to drop some questions in and we can turn to that as we wrap up today's webinar. The 5 Pou of Pou Ora. In a land where mountains meet ocean and sky, where whānau need healthcare and live to try, 5 Pou stood proudly, all sturdy and true, with a mission for me and one for you. Workforce cried, we're strong when our people were trained, supported and valued. Their skills are well maintained. Acute care chimed in where trouble meets fast. We act with precision so wellness will last. Proactive, preventative sang, don't just wait, let's keep the folks healthy. Isn't that great? Innovation, sustainability smiled. We're smart, we care for tomorrow. That's how we'll take part. The collaboration cheered, together's the way, sharing and learning to brighten each day. 5 Pou stood tall, holding whānau with care. Pou Ora's the promise, we'll always be there. maybe a reflection of far too much Dr. Seuss books happening in my house at the moment, but I hope that kind of summarizes, I think, our beautiful 5 Pou, our 5 pillars, our 5 work streams, the 5 things that each and every one of you should be thinking about as you're adopting and implementing models of care into your general practice. And we hope that this is a framework that you'll be able to really use and adopt in that space. I'm going to flick over to the Q&A. And we're looking pretty good at my end, unless things aren't refreshing. So on that note, I might hand back to you, Marama, to wrap up our webinar this afternoon.
Beautiful. Oh, well, ngā mihi aroha kia koutou mō tō tai mai ki tēnei wānanga. It's been really enjoyable to be able to share this from our team to yours. We have recorded this, and it will be available on our website. So do feel welcome to share it out, share it to your team. It's a great thing to sit down for a cuppa and listen to us for an hour. I couldn't think of anything better for you to do on a rainy day. So, ngā mihi kia koutou. I will whakakapi our session with karakia and do go on, enjoy the rest of your week and make sure you have time for your hauora. Ko rangi nui e tūnei, ko papa atu anaku e takato nei. Kia tau te rangi Māori e ki runga I o tātou mahitahi. Haumi e, hui e, tai ki e. Ka kite whānau.